Welcome back to my channel, Dr. Stefano. Today I will listen about diseases related to respiratory system. In this video we'll talk about quick revise about physiology of respiratory system, the diseases related to the respiratory system. Let's start. Physiology of respiratory system are pulmonary ventilation or breathing. They are go to the alveoli, then will exchanging between the alveolar epithelium and the capillaries surrounding them. The structure cells of the alveoli has 3 cells. Type 1 pneumocytes are the cells that are responsible for exchanging of oxygen and carbon dioxide. The type 2 pneumocytes perform 2 important functions. They are responsible for repair damage and producing or secreting the surfactants. The immune cells known as alveolar macrophages in the alveoli. Surfactants are produced by type 2 pneumocytes. The surfactant prevent the alveoli from collapsing completely between breaths. It's fatty substance, a group of phospholipids that reduce the alveolar surface tension. The alveoli can be compared like a gas in water or bubble. The air inside the bubble or alveoli covered by wet or fluid like a bubble. So the surfactant is located inside the fluid, keeping its shape and never making the alveoli collapsing. The infant produces the surfactant between 5 to 8 months of pregnancy. So because that, the infant can't be breathed because there is no surfactant. In this picture we can see the air gases concentration levels in the higher altitude and the sea level. In the higher altitude will be the concentration of gases less than the sea levels. You can see this picture. The gases contain the oxygen, nitrogen, carbon dioxide and other gases. How the air gas molecules transfer? For example, the oxygen. We have the oxygen percentage pressure in the alveoli about 104 milliliter mercury, but in the capillaries is about 40 milliliter of mercury. So this molecule of oxygen will transfer from the alveoli to the capillary. So during the transferring, the pressure or percentage pressure of oxygen will decrease during transferring, and the percentage pressure of oxygen in the capillary will increase. So it's still transferring till the pressure of oxygen same or equal to the capillaries. The same happen with the carbon dioxide and the nitrogen. They will transfer from the alveoli to the low concentration or low pressure, the capillaries. They still transferring till they equal to each other. And the carbon dioxide inside the capillary are more than the alveoli, 45 in the capillary and in the alveoli 40. So they will transfer from the capillary to the alveoli from high concentration or high pressure to low concentration. So this is how the air gas is transferring and how they are working. We finished the revising of the respiratory system physiology. Now let's start about the diseases related to the respiratory system. We have first one is asthma, chronic respiratory condition that causes difficulty breathing due to inflammation of the airways, allergic reaction. Causes of contraction of smooth muscles and in the bronchial and bronchiolar wall, excess mucus secretion and insufficient contraction of the alveoli. Asthma symptoms include dry cough, wheezing, chest tightness and shortness of breath. Everyone who has asthma needs to have rescue inhaler to open the airways quickly during the asthma attack. Asthma can occur during the strong emotion, smoking, stress, etc. conditions. If it's not treated immediately, can cause asphyxiation. State of lack of oxygen can cause to death. In this picture we can see the normal airways. The airways for the person who have asthma but didn't have any asthma attack. This is the person who have asthma attack. The asthma attack will cause the construction of the bronchial wall and bronchial muscles, smooth muscles, the secretion of the mucus and the endothelial cells or the endothelial layer will be contracted, so the air passage to the normal person will be high, but during the asthma attack will be less than they needed, so there will be lack of oxygen to the person and they will cause the death or lose the consciousness for the person. So that's why he needs the rescue inhaler to open his airways and preventing of contraction of the bronchial wall and smooth muscle cells. The second disease we have is rhinitis. Rhinitis is inflammation and swelling of the mucous membrane of the nose, characterized by runny nose and stiffness and usually caused by common cold or seasonal allergy. Colds and allergy are the most common causes of rhinitis. Symptoms of rhinitis included runny nose, sneezing, cough, and stiffness. Typically, the diagnosis is based on the symptoms. The virus's forms of rhinitis are treated in the various ways, such as the antibiotic, antihistamine, surgery, etc. Rhinitis is classified as allergic or non-allergic rhinitis. The cause of non-allergic rhinitis is usually a viral infection, although the irritant can cause it. The nose is the most commonly infected part of the upper airways. The rhinitis may be acute, short-lived, or chronic, long-standing. Acute rhinitis commonly results from viral infection, but may also be a result of allergic bacteria or other causes. Chronic rhinitis usually occurs with chronic sinusitis or another name for it, chronic rhinosinusitis. In this picture, we'll talk about the allergic rhinitis. The allergic rhinitis can cause the swollen sinus lining, inflammation, stuffy or runny nose, itchy or sore throat, and maybe cause the asthma. And the trapped fluid in the sinuses can cause the sinus infection, so be careful from the allergic because it's so dangerous, maybe cause the infection of the sinus. And the blocked of istochine tube may cause ear congestion and infection for the ear. It's connected to the pharynx to the middle ear. The next type of disease we have emphysema. It's a permanent disease causes enlargement of bronchi accompanied by destruction of alveoli wall, shortness of breath, parietal collapse of the airways, and loses lung elasticity. A person suffering from emphysema cannot exhale normally even if he forcefully do it, and the carbon dioxide in his body will rise up. Fortunately, adults has 8 times alveoli as needed for routine activity. Acute cases of emphysema aren't prevalent. The emphysema is divided into 2 types, depending on the causes. Causes for the cigarette smoking called the centrocanal emphysema, upper lobes, or the second one by alpha-1 antitrypsin deficiency called the paracanal emphysema, affect the lower lobe. The alpha-1 antitrypsin is protein produced in the liver that protects the body tissue from being damaged by infection. It is released by immune system. The main symptoms include shortness of breath and cough with sputum production. The emphysema is progressive disease, meaning it's typically worsen over the time. The diagnosis is based on the poor airflow that measured during the lung function test. The treatment of the emphysema didn't known until this moment, so we can only preventing the emphysema or reducing exposure to risk factors or reducing the emphysema condition in the patient. So we can improving the indoor and outdoor air quality. In this picture we can see the emphysema and the patient and the normal lung. The normal lung, the alveolar ducts are normal. The alveoli sac are damaged or collapsed. But in the emphysema person has the compressed duct, and the alveolar duct will be compressed, didn't let the air come through it, and the alveoli sac will be collapsed because the destruction of the alveoli walls. Pleurisy. Pleurisy is a type of infection, affect the pleura. It affects part of your body called the pleura. We talked about it previously. Bacterial infections such as pneumonia often cause pleurisy. It can also cause by virus such as the flu or by fungus. Pleurisy symptoms a sharp stabbing pain that causes you to take small amount of breath because it's worse when you try to take deep breath. Pain that spread to your shoulder or back, fever, cough, and chills. Pleurisy treatment. If a bacteria by taking antibiotic can make it you better, the treatment for pleurisy. If it's fungus, they will probably give you an antifungal drug. If it's virus, you will get better on your own in a few days or weeks. In this picture we can see the pleurisy for the inflamed person and the normal person. This is the visceral pleura, the parietal pleura, and the pleura cavity, this one, because the lung is covered by 2 pleura, visceral and parietal, and between them pleura cavity that has liquid, and they will keep and maintains the shape of the lungs to never make it collapse. Now we finish our lesson. Please like and subscribe to supporting me posting more videos about medicine. I will put my Facebook page on the description of this video. Thank you for watching. Goodbye.